Hi, welcome to the Worthy Physician Podcast. I am your host, Dr. Sapna Shah-Hawk, a board-certified internal medicine physician. Keep life simple. You are human. You are worthy. Remember what matters to you. Our goal is to help physicians remember this and to make it a reality through addressing various components of physician burnout via podcast. This is meant to be used as a tool to help guide physicians. It does not take place of professional medical help. Opinions reflected in this are my own. In this episode of The Worthy Physician, I sit down with a former classmate from medical school, Dr. Meghan Hampton, who is board certified in occupational medicine. Her story is a unique one, as she has overcome some unimaginable losses. We do not go into it currently, but just take my word for it. She is quite resilient, and she shares how she stays true to herself as a female physician and one with a flair and personality. So Meghan, tell me about yourself. Tell me, how do we know each other? What are you doing? What's your profession? Where did you study? Where did you do residency?
And I have to remember everything. So we met in medical school to become a doctor. I had these ambitions to actually do primary care because I wanted to help people have a healthy lifestyle, encourage them to have healthy diet, exercise. I had rose-colored glasses, I would say, thinking that I could fix people and convince them, to be healthy, blah, blah, blah. And it was actually because we did rotations. Well, we had someone we shadowed once a month for our first and second years. And I was placed with primary care doctors. So I was with family medicine doctors both those years. And I realized, it was probably even my first semester realizing that the primary care doctors didn't have enough time to spend with their patients. I realized I didn't have time to help them be healthy or whatever. So for a while there, I actually wanted to become an endocrinologist because I thought, I will be able to fix people this way. I'll just help manage their diabetes. And I did diabetes night and then at the free clinic and realized that I couldn't convince people. It didn't matter what I said. And I was pretty jaded from that. I would honestly say it was jaded in my first year in medical school. I was what on earth have I done with myself? I thought I could help these people, but they don't want to be helped. So for a while there, I think I wanted to do emergency medicine because I'd worked in an ER when I was pre-med. And then during our rotations, I think I went from wanting to do critical care. I wanted to be a surgeon at one point. That was only a month or two. And then I decided to start go into anesthesia because I could do critical care from that. And another interesting thing was that I decided to get my Master of Public Health when I was in medical school as well, because initially when I had signed up to be a part of the MD MPH program, I thought I would go into public health and do more preventive medicine. But with all those experiences of jading me, I decided that I would get burnout. I was burnt out as a medical student. I'm not helping anybody,
Yeah.
But I wanted to finish the degree since I started it. So here I am, this anesthesiology resident who has an MPH, and I'm doing anesthesia. And it was the chronic diseases came back. I thought if I did anesthesia, I wouldn't have to deal with so much chronic disease, but that's all it was, because we would have people with all these chronic diseases who were having surgery, or they kept needing more surgeries because of their chronic disease. And I was I can't do this.
Wow.
It left me really, I was jaded then. And I was
But to clarify, how far were you into your anesthesia residency before you realized that?
It was about halfway.
A lot of my female attendings not getting the respect that the male attendings got. Plus, I'm shorter. I'm only 5 feet tall. And I noticed that dynamic with even for the women, like, especially because there were a few more petite attendings that I worked with, and they definitely got the least respect out of everybody. And so I was like, I can't have this be the rest of my life.
I'm going
So
to ask for some delineation. How long had these, not that it's right by any means, okay? Right? For the listeners, I'm not for disrespecting anybody based on predisposition, or we're all human, we all deserve respect. How long had they been attendings, if you had to guess?
I mean, one of them had been an attending for at least 10 years at that point. There were ones that had been longer. I mean, they had been, I would say, maybe even 20 years. There's only one that I think got some respect, but that's because she had been around like for her entire career at this hospital. So people knew her, and also she was like 6 feet tall, and she was like such a firecracker
Yeah.
that they listened to her. But that's not my personality. I was like, I knew I wasn't like her. Like, my personality wasn't like her. So I knew I wouldn't get that respect, so it was like, why fight it? I'm not going to change myself to fit in here to get some respect. It wasn't even what I deserved.
Just by walking through the door as a human, you deserve respect, right? But
Yeah.
I think that's really powerful what you said there.
Yeah, it's just like, even I think even if I had changed myself, it wouldn't have worked to get the respect I deserved, and I wouldn't have been authentic anymore because it wouldn't have been me.
Right. But I think that's really huge that you had that insight that you were not going to change who you were to mold to this person that people that don't matter, right? In the long run, they don't matter.
Mm-hmm.
You weren't going to change who you were. I think that's really powerful. And how were you aware of that? And number two, how have you held on to that?
I think I was more aware of it just because that's how I grew up. My mom always thought it was really important to be an individual and not be like everybody else. So I never was that child that grew up wanting to look like everyone else, that needed to fit in. Like, I was brought up being told it was okay to be unique and okay to be me, and it's okay to be different. So when I realized that I was trying to fit in and trying to mold, and I think that's what medical school does to you, because I realized, I pretended to like rotations that I despised. Like, I thought they were the worst ever. And I could have never imagined doing that type of medicine, but it was ingrained in us to pretend to have a good time, be, super positive about everything. It's all okay. Look, you need to get a good evaluation. So I was actually extremely good at faking it in medical school because I wanted good evaluations. I wanted to pass, and but I wanted it over with. Like, I just wanted it to be done with it. So I learned that that's what I needed to do. But then somehow I just was like, this is not me. Like, this doesn't feel good. And I don't know. I think it was just me sitting in the OR and just having this realization, like, this is not what I want to do for the rest of my life. And that this isn't even me at all. Yeah. And I don't think a lot of people take that time to step back and analyze themselves. And honestly, so one thing that had happened was I was told I wasn't assertive enough and I needed to work on my assertiveness, which I tell people that nowadays and they laugh. They're like, "Are you kidding me? You're like a super assertive person." So I don't know if that part of me had been squelched by medical school because I really speak my mind and tell it how it is. So I ended up going to this. I found some therapists that specialized in helping people with their assertiveness. And I only went for 2 sessions. And she literally said to me, she's like, you don't have any problem with being assertive. Like, I don't know how else I can help you. And in that moment, that's when the light bulb went off, and I was like, I don't have to keep doing this. Like, I can quit. Like, that was because I think I realized this isn't me. Like, I am an assertive person. Somehow I lost that in this pretend land of keeping everyone happy. And I wasn't me. And because I wasn't me in that environment, I just needed to get out of that environment. So I was like, I'm going to quit. Like, I'm going to find something else to do, which is what I did.
That's amazing because no, I'm serious, right? Because
Yeah.
during medical school, I always say for some of us that came in with being assertive, if we didn't meet a certain mold, that was kind of squashed. Not kind of, it was squashed. Would you agree?
Oh, it was 100%. Like, you were told to conform and to be good and to just like keep quiet, keep your head down, do your work. And it's like the people who you did see do that got rewarded.
I think it's great that number one, you have that insight, which many people do not, to not conform and to not change you because the world needs more Megans. The world really does need more Megans.
Thanks. But it's true. I think a lot of people don't allow their true self to be seen, and they're constantly faking something. And I remember, so I do you remember, so I guess you weren't in my actual like final, oh, it was like health of the public. And we had to do this thing where do you see yourself in 10 years? And even though I was going into anesthesia at the time that we did this, like I remember Clarice saying, well, you're going to be wearing a tutu. And I was like, well, I don't know how I'm going to wear a tutu in the, OR, but okay. Yeah, I would like to wear a tutu. And I remember even when I was in my occupational medicine residency, this attending took me and my friends aside and told us how to dress for success and told us to buy this book, which is, I think, from the 50s or 60s, 70s. I don't know. It's old and tells you how to wear your hair, how not to basically, you're not even supposed to be attractive. That's what it comes down to for females because you don't want to distract the men. And basically, the whole thing is everything that I wore was like inappropriate because I liked sweaters and the clothing I wore was too light colored. It was too fun. And it bothered me. It kind of messed with my head reading this book. And then one day it was like that realization again where I'm like, screw you. I'm miserable wearing this clothing. And so I went back to how I used to dress. And then actually, I do basically wear tutus to work now because I have all these tulle skirts and I wear them to work and I don't give a crap. Like, and no one there, like, that's why I think I know that I'm where I should be, is that no one ever says like that I can't wear that or it's not appropriate. They're just like, you're the only person who can get away with wearing this. It matches your personality. And so it's just refreshing to have people like actually be okay with me being who I am, especially in medicine, because that's like so rare.
So you said that you were jaded in medical school. Mind you, there are 4 years of medical school traditionally. Sometimes there's an MPH program like what you did. And then there's just the scenic route like what I did. Then there's like the MPH, MD, JD, and other things. At what year did you find yourself jaded? Was that like first year, second year?
Yeah, it was totally my first year, first semester. Like,
Wow.
we are probably a month or two in, and I was like, what have I decided to do with my life? I think I made a mistake, like, but then you already were like, well, I'm paid for a semester and like I owed all this money already and I'm kind of trapped at this point. I better just finish. So, yeah, that's why and I think we just have this whoever gets into medical school has so much, I think, even grit and stamina that the vast majority just push through it. So, I mean, there's so few people I think that I even can recall that actually just flat out quit, you know? And I mean, I did want to, like over and over again. I was just exhausted and I didn't want to do it anymore. And yet I still did.
Why did you get up on those days you did not want to and push through? What was your driving factor?
It's probably that sense of not wanting to be a failure. So, like that I had committed to something and I didn't want to fail at it.
Yeah, I can relate.
I mean, as much as I didn't want to, I was like, oh gosh, I can't believe this. And yeah, I don't know. Because I don't, I mean, and this was I think there's a lot of people that I knew who didn't want to do it anymore. And then there's those that were just like, I don't know, like they had some crazy, I don't even know what it is, like endurance or it was like this is what they were meant to do and they were so driven and I'm like I don't feel like this like you do. This is not making me happy at all. So, but I think you see them and then you feel like, well, if they can do it, I can at least pretend. So you just keep going.
And mind you, the ones that go into medicine really are like there are better ways to make money. So it's not for the money. It's
No.
for because you truly want to make a positive impact in somebody's life, right?
Yeah. Yes. 100%. That's what, yeah. And I think that's one thing that makes it hard because everyone, I mean, when people do talk to me or they're like, oh, you make a ton of money. I'm like, no, not really, not compared to some people because I mean, I work for the government. So, like,
No, but I mean
which I mean,
that's the thing, right? Everybody thinks that doctors, right? First year of residency, I was asked. So come on, what car do you really drive? Like I drive a Mazda 3. Come
yeah,
on. And that was kind of an I mean, I didn't take any offense to that. I kind of laughed it off. It was kind of ironic, right? Because nobody knows how much I mean, like the general public does not know the debt it takes to get in, like to even go to a state school. We both went to a state school, right? KU.
I,
Does not understand how much it costs to go to medical school, and then the amount that the physician salary has been cut, and they think that the cost of healthcare rests on our back, which it's actually not, right? Because most physicians, not all,
no.
but the majority of physicians are now employed by hospital systems.
Yeah, no, it's really true because and I think that probably explains also why we're okay not having the luxuries that a lot of people think doctors have
Yeah,
because I didn't grow up with it. So I don't expect it. Like, I don't
right.
expect to have this gigantic house, a luxury vehicle. Like, I drive a Subaru and a paid off Subaru, and I love this thing. And I have no intention of buying a luxury vehicle. I don't want a 5 bedroom house with a pool. Like, I know that that doesn't make people happy because I see friends that I know that have these things and they are not happy because that's not how that doesn't bring happiness to you because the happiness is always within you. You just have to find it.
tell me how you overcame burnout. And
Yeah, I think now that we've talked about it, each time I was burned out, which happened numerous times, it was mostly because something didn't align with my core values. When I really looked into it, like I was being asked to do something that wasn't authentic to me.
Mhm.
And so each time I had to basically stop doing whatever I was doing and try something else, which took a lot of me having to do that, especially since each new job that I had, I was super excited about. And I thought this was going to be the one, like, this is exactly what I want to do. And then I would go there and find out that it was different than what I expected, or I was being asked to do something that I wasn't okay with. Um, and that, yeah. So, I mean, I think I told you, and being out of residency for 6 years, I've been on my sixth job. Like, that's insane. So, but it took me that many times before finding something that I've been able to stay with, that I don't feel like I need to leave every single day, like where I'm like not constantly looking for a new job, because I don't look at job postings like I did. I mean, I used to be looking for a new job like many times throughout the day. So, and even when you're talking about reconnecting with yourself and things that you cared about before medical school. So, even how I got into occupational medicine, I think it was just knowing that I would actually maybe have more time with my patients, and be able to, like, I have the time to actually address things that I'm not able to do. A primary care physician really doesn't have that time because they have so much time constraint. So,
so
yeah.
I do primary care, right? I do
Uh-huh.
primary care in a rural setting in Kansas. And honestly, I love it. I love where I'm at right now in life. And I love the people with whom I work. But it took me a couple of changes to honestly know, like, boundaries and what I wanted to do and how to find that work life balance. So I think it's interesting that you say that you kind of measure it, and this is oversimplifying things, don't get me wrong, but that you can dress to who you are. Because let's be real honest with ourselves. You're kind of like glitter in a dark room, right? And I mean that in a very, very positive way. You've always been a ray of sunshine in a profession that seems to suck the lives out of its people, like out of like it's kind of a vampire of energy. It really sucks the life out of you. And we all kind of get up because we're trying to work for something bigger than ourselves, right? So the fact that you can
Yeah.
be yourself, but also it's interesting that you could also say, hey, you're not looking for another job on whatever source you have, whether it's LinkedIn or Indeed.com, or answering one of the recruiters that sends multiple emails and texts a day. And that's huge. I think that's a really awesome benchmark to surpass.
Yeah, no, I completely agree. And I think you were even talking about finding what brought you joy before medicine, because I remember there's like a quote that what is it, like, who were you before the world told you who you were supposed to, who you were supposed to be, or something like that.
Right.
And I remembered seeing that, whatever that quote is, and I was like, yeah, who was I before I decided that I wanted to become a doctor, and like did what they wanted me to do to be this successful doctor. And I remember in college, I did have this dream. Like, what, there's something, it's like, well, what is your dream job. And I literally just said to myself, oh, I'd be a yoga teacher and a wildflower guide. And I just said it as a
Right?
joke, like 100% as a joke. And I was like, yeah, that'd be cool. But, I need a real job. And a real job would be being a doctor. Like, I have a brain and it seems to work okay. So I was like, I'll go with my original plan because this other thing's nonsense. And so, and it's just interesting. Like when my husband died, I was like, for some reason, it was like, I started, I went to, because it was like right at the beginning of the pandemic, and this person I knew who's also a physician who got into teaching meditation. She was doing a meditation retreat, and I was like, yeah, I just want to do anything to keep my mind off like being home by myself, because I was literally had been with this person for 14 years of my life and was now by myself in the middle, like at the beginning of the pandemic. And I
Wow.
just wanted social interaction. And this is before Zoom was like huge, huge. So she did it on Zoom. And then I just started meditating after that twice a day because she asked us to make it non negotiable. And I've continued to do that since last June. So it's been a while. And then she decided to do like a meditation teacher training. And so I was like, yeah, I'm going to sign up for it. Like, I don't have anything else to do. It's pandemic. I go to work, I come home, and like, what else? So I was like, yeah, I'll sign up for that. And then for some reason, because yoga and meditation go together, I remember finding out that this other physician I knew got became a yoga teacher. Like she quit her job and became a yoga teacher. And I was like, man, I wish I could do that. And she's like, well, you can. And that was like the biggest statement ever to me was, well, you can. And just to have someone tell me, like, give me permission, because I wouldn't give permission to myself. And I was like, I can do it. Like, what is stopping me? So I went and started researching class, training programs. And I'm like, well, the pandemic's happening. As far as I know, any conference I was going to go to is canceled. So I have all these weekends free. So I did. And the funniest thing of everything is I applied for this yoga teacher training program and they had an interview. And I honestly had so much imposter syndrome. And I was like, they're not going to accept me. I'm not good enough for this. Like,
And this is coming from a doctor, right?
I
Like a board
good
certified
enough.
physician.
I was like, they're not going to accept me. And then, of course, they did. And I'm like, and it was just, yeah. So I start, and then I did so I did the meditation, then the yoga teacher training. And then I recently signed up for another training to become a Kripalu mindful outdoor guide, which that once again was an application process. And for some reason, I didn't think I'd get accepted again. Was like, I'm just not good enough. Like, I'm not outdoorsy enough. Like, they asked us to tell about our weaknesses. And I was like, yeah, I don't know how to start a fire without a match. And I don't know how to build shelters.
Yeah.
So, like, I'm just going to put it out there that I'm probably not like the best outdoor person. But I told them, I'm like, when I go outside, I just keep quiet. I participate. Like, I can get rained on, be freezing cold, and I'll be okay. Like, I'll just like hunker down and do my normal thing. So, yeah. And
But your normal thing is to be you.
yeah, but I think that is like even that hunker down, like I think that's what got me through medical school. It's like when things are really, really bad, I
Yeah.
just hunker down and do the work and
Yeah.
just keep quiet. And so it's just interesting that like was even my thought about when I'm outside and there's like, I'm being hailed on and rained on and like it's freezing cold. And because that has happened when I went hiking with my brother before. So it's like, yeah, I have this default mode that just like
Yeah.
gets me through everything. So that is probably how I got through medical school, residency, like my first jobs that I
Right.
did not enjoy at all. So it's liberating, I think, to finally be doing something that I really have always had the passion for. So, yeah.
No, I think that's awesome. And exactly as you said, liberating. But can you tell me exactly what type of certification you're working on right now?
My
Break that
current
down
one?
for me because I'm not familiar with that.
Oh, so Kripalu's this big like yoga. They have like a retreat type center, but they also do training. So they do a lot of yoga teacher trainings. They do some like a mindful movement training. They even have like a weight loss program. I mean, they do a lot of different trainings and like meditation training. So it's just a big center. It's up in the Berkshires, which is in Massachusetts, I want to say. I'm
Mhm.
terrible. I don't know. And so I'd heard about it when I was doing my teacher training. And then I just decided to look into, oh, what do they have available? And then I saw they had this online program to become a certified mindful outdoor guide. Well, it's certified Kripalu mindful outdoor guide. So I decided to do that. Uh, be, it's kind of because there's a lot more. I feel like a lot of people have gotten away from nature because we all are a part of nature. Like if you like you said, ashes to ashes, and that's true. Like we come from the earth. We're
Right.
made up of all this organic material. I mean, that's what we are. So as much as we try to keep ourselves away from being outside, like by putting ourselves in buildings with air conditioning, heating, but really we are a part of nature. And if you think about it, even when we put all of our buildings into on the land, there's nature around us. We still have our bugs, we still have little rodents, we have birds. I
Yeah.
mean, it doesn't matter, no matter what. Think about these gigantic cities, and there's still like non-human life surrounding them. There's somehow that a dandelion's going to come up between the crack in the sidewalk, like it's always trying to come through back to us. And I just felt really called to help people reconnect with nature because I think that's really the healing aspect. It's like the most healing thing we can do. So things, but
But how have you overcome burnout in general?
I think the way I have overcome burnout is just by recognizing that something wasn't okay in myself, that I had a feeling that it wasn't what I wanted, whatever was happening, and then deciding to change
Right.
and just like listening to my intuition for what I needed to do next. Not really so much because for the longest time I did listen to other people and their opinions of what I should do, but that's not real, like what the real answer is for anybody. You have to like go deep down and figure out what you really want because nobody can tell you what you want.
How did you develop that awareness and how did you not lose it through medical school and residency? Because very much so, medicine is a very distinct culture. Like MD training is a very distinct culture. And also, if you don't conform, like I will break you. That's kind of the mentality I picked up on. I don't agree with it, nor do I try to practice it. Because
No,
I'm. Go
I
ahead.
know it. I know exactly what you're saying because I do think, and like I said, I even recognized in myself before when they were trying to suppress who I was, and I allowed it to happen, but it wasn't a good feeling. Like I wasn't happy then at all.
Yeah.
So I think it's just recognizing when you're not being authentic and then deciding that you want to change that.
And for somebody who's listening that maybe is struggling with actually recognizing that, what advice would you give them?
you really, it just comes back to noticing how you feel in the situation,
Mm-hmm.
like noticing how your body feels. Like if your stomach is always in knots, if you feel like your heart's racing or you have a pressure in your chest or your stomach sinking all the time, then there's something wrong because your body shouldn't feel that way. Like your body is very, very smart, but we learn to ignore our bodies, whereas we really need to listen to what's happening inside of us. Like, does
Yeah.
this feel good? And if it doesn't, that means there needs to be more exploration for why it doesn't feel good because something's wrong.
Right. How have you addressed burnout, particularly like in medical school and residency and life, besides being true to your authentic self?
Well, the only other thing I can think of is that I just quit. Like I think people always say pause and pivot, which is probably the real thing, except I always tell people I excel at quitting things because I'm like, yeah, this isn't working. Because I'm really good at quitting. Um, and I think that's what's interesting is a lot of people are taught not to quit. Like quitting is bad. It's not okay. Like it comes back to that failure mentality. But honestly, the best thing you could do for yourself or other people is to quit at times.
Why do you say that? Expand on that, please, because I agree with that mentality. I told
Yeah,
you a little bit about myself, and we've known each other, God, since 2006.
yeah, 2006.
I just shared some things with you about myself that you didn't know, and so I completely back your theory, right?
Yeah, I
Why
know.
is
It's
it okay
like
to quit?
because if it's not you, if it's not working for you, it's okay to find something else. And
And
it doesn't
so,
matter what other people think or what they say about you. Cause I mean, I have this reputation of like this person that quits stuff, blah, 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 and I mean, I've had people tell me this, like, you can't keep a job. I'm like, I can keep a job. I choose not to keep that job because not, it's not good for me. It's not even that it's not making me happy. It's just not good for me. If it's detrimental for you, there's something else. There's always something else you can do.
oh,
Believe me, because and even then, even having this history of quitting, having 6 jobs in 6 years, I still have people who try to get me to go work for them, like those, like you were saying, the emails, the phone calls. So I'm like, they don't really care. Like someone might say, oh, this looks bad, but it doesn't look nearly as bad as you think, like it doesn't matter in the end because what really matters is that you are doing something that you do not mind doing. I mean, it doesn't have to be love because I think that's one thing I grew up with. My dad once said to like us children is like a job is not who you are, it's just what you do.
right.
And that is something that physicians have a very difficult time understanding because I think the way medical school and our training is that it becomes us. Like I am a doctor. Like, but no, you're not. You're somebody else. Like you are this much more complex human being with so many other qualities. You are not just a doctor. You're so much more. So you aren't just this job that you have, and it's okay to leave it.
Amen. And I will tell you that permission, right? You said it. I'm going to reiterate it. It is okay to leave a job that is detrimental to your well being,
Yes.
however you define that. But I will challenge physicians, right? I will challenge physicians to say, a job is detrimental to me when I cannot look at myself in the mirror and realize who I am. I cannot look at myself and say, I now hold the same values. And mind you, values and life interpretation, experience, view changes over the years and experience. I'm not going to take that away from any profession. But if you cannot see your true self and look at yourself literally in the mirror, and I would challenge any physician, non-physician, anybody in the healthcare field, legal field, whatever, if you cannot truly look in yourself in the mirror and say, I recognize who I am, do a reevaluation. Like, that's okay. That's okay to quit. Quitting for somebody.
Yeah, I completely agree.
I think it comes down to the reason why. Is am I doing this because it's too hard? That's okay. Like, your self limit. Am I doing it because, yeah, I could, but I want to put forth the effort? 50-50. Am I doing it because I'm going to feel like I sold my soul to the devil? Right? If you have to ask yourself that, don't do it. Don't do it, period. It's okay to fail. And and this is the thing that I have with doctors, physicians. Failure is okay. Like, to fail is okay, right?
Yeah, it really is, though. I failed so many things. Like, it's okay.
You still got up and you're still here.
Yeah.
I have failed at multiple things, which show me who hasn't. But that's the thing. Show me who has not failed in life. And if they say I've never failed, if I've never failed at life, then they're probably part of a cult and you should be running away screaming.
I think they're also probably not admitting that they failed at something,
Right. Yeah.
Because anyone who has, some of them, some of it's even just having like a failed marriage, but here I am super successful in my career. Well, or, their kids don't even know who they are because they're being raised by a nanny. It's like I think everybody is a failure in some aspect. So
Yeah.
it's fine. But that's just how I think.
No, I totally agree.
You can't do everything. It's impossible. You just can't.
Yeah, we're not superheroes, man. Marvel and whatever, they really portray human beings to be top notch. And I think doctors are top notch. I think none of us went into medicine. Most of us did not go into medicine because of the money or the prestige. I know I didn't. Could have made more as a business consultant or what have you. But I think a lot of us go into it with the altruism we want to take care of our fellow human, and we really want to try to make an impact. As a primary care doc, I've had to really, package that motivational speaking into like 90 seconds, right? And while I can deliver that through 11 years of practice, and I still believe in it, yeah, I don't have as much time as I want with my patients, but nonetheless, failure is okay. See, doctors look at it as failure, but entrepreneurs will look at it like, okay, what did I do right? What did I do wrong? What can I learn from this? How can I make it successful the next time? How did you, Megan, approach the changing of jobs once a year for the last 6 years? How did you approach that? And how did you get up every day and say, I'm going to reconquer this? No, I'm serious, because I think that's wonderful. I think that's beautiful. And I think that I have mad respect for that, right? Because you stay true to your authentic self, and I think that's an art form. Seriously.
Yeah, and I think it was honestly, it was like I never went into the same job each time, like the same type of job, because pretty much the at least the type is generally you're going to have the same experience no matter where you are. So you have to look at what you don't like about a particular job and then make sure that you're going to a new job that doesn't have that whatever aspects you're not looking for. And there may be something that you thought you didn't like that you end up missing. Because at one point in time, I did do something where I had like no direct patient care. I just interviewed people on the phone and I thought,
Wow.
oh, this is going to be great. And it was tiring. It was exhausting. Like I lost my throat was constantly sore. It like changed. It was hoarse all the time. And it just, it wasn't like a rewarding type of work. And
Right.
so I just knew, well, that didn't work. I'm just going to try something else. So I had to figure out what were the things that I really, like making a list. What did I want in a job and what I didn't? And then made sure that I didn't ever go back to the type of job that I just left.
How many hours did you spend on that each time you transitioned?
I don't know. I think it's just a running. I don't even actually have a legit list anywhere. It's more in my head where I sometimes have to check myself where I'd be like, yeah, but I didn't like doing that. So I don't want to do that. It's really interesting because even when I started my current job, at one point I was still like, oh, someday I want to be a supervisor. I think I should be a medical director, blah, 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 blah. Like, because I know how to do things correct and nobody else knows how to. They don't do it right. So that's why I need to be in charge. And I actually literally thought that this was the case probably up until a year ago when I finally checked in with myself and realized that it was completely my ego that thought that I knew what was best and only I could do it correctly. And
Mhm.
then really realizing I don't want to be in charge of anybody. Like, who needs that headache? So I was like, what is wrong with me? I was like, because I was literally thinking, oh, I'll leave this job and become a supervisor somewhere and be, some high upper management type person and make sure everybody's doing everything correctly. And then I was like, does it, that is not going to, I was like, do I really like telling people what to do? I'm like, no. Do I like having to reprimand people or counsel them? No. So how am I going to like this job that I think I want? Like, no, it's not going to happen. So I think that's what, and you have to ask yourself, like, what really is involved in the job? And people lie to themselves because I did it, where they're like, oh, no, I don't really like this, but it'll be fine. I can do that. But honestly, if you're telling yourself it's going to be fine, that's not the job for you.
How many times did you have to ask yourself that? I have to ask myself that more than once. More than once. And if
Yeah,
that's your
that's the
response, is
thing.
fine.
Yeah, I really did have to ask myself numerous times, like every single job, you know, I, and it was like more than once at each job. And that's what I was telling you. I mean, I still do it all of the time where I have to like check in and be like, no, this is okay as it is where I'm at. It's
Yeah. Unfortunately, after talking with Dr. Hampton, we did have some technical issues, and I was unable to capture me thanking her for her time on a Sunday afternoon to give an interview over Zoom. And one thing I really want the listener to take away from this podcast is to be true to yourself, no matter how different. Do not be afraid to let your personality shine through. And give yourself that permission. If it is not good for you as a person, it is okay to walk away. Thank you for joining us today. This concludes the podcast. Subscribe, tell a friend, follow us at www.theworthyphysician.com. Remember, you are worthy, you are human. Take care.
Start again the second time.